I'm Dr. Matt. I'm going to do your examination today. It looks here that you were admitted 2 days ago in the hospital. Okay, so I'm part of the hospitalist group and I am in charge of your discharge. Now, I understand from the nurse that you're not feeling that well, a little bit under the weather. Okay, can you please verify your date of birth? Okay. And when did you first start to feel these symptoms? Last night. Okay. Any night sweats with that? Yeah. Okay. And do you remember getting out of the room before that? Were you in contact with somebody who maybe presented with some viral infections? Not sure. Okay. Right, your temperature was 99.8 the last time the nurse took it, and it looks to me like you're breathing a little bit harder than normal. Okay, labored breathing. That might be an indication of just a virus that may be wandering around in the hospital. Okay. So I'm going to take your vital signs again. Just going to go ahead and place that there. Okay, now I'd like to put on some gloves. I'm going to go ahead and place this under the tongue. Can you please open and give me a big ah? Good. Just hold it like that under your tongue. Okay. It's raising up pretty fast. I would say you're spiking a fever. Okay. Well, alright, 101.1. Go ahead and toss this. And you mentioned that your breathing is a little bit labored. I will put this on your finger, on your index finger. Okay. And this position that you're in really helps you to breathe a little bit better, right? And it seems like you're using about 2 pillows. Okay. Looks about right. Now, oxygenation is good, so it looks like it's 99% in on room air, and you don't need any oxygen. And your heart rate is a little bit labored, 104. I would say I would like it to be less than 95 in the ideal world, but I think because you are having a fever, then definitely your heart rate is on the higher side. I'm going to go ahead and take your temperature. Which arm would you prefer? This one is okay. All right. Just going to go ahead and lift the gown up a little bit. Good. Just going to wrap this around your arm. Okay. Perfect. Just hold it like that. Okay, so your blood pressure is also a little bit elevated. I know you normally do not have hypertension, so we're going to attribute this to the viral infection that you might be going through. Okay, let's go ahead and put this right over here. Now, is it okay if I take a few measurements? Okay, so let's go ahead and see what kind of measurements we need. Okay, so we definitely need to check your fingers, head circumference, okay. And we need to check your legs too, your hip alignment, and definitely your arms. We're checking for any DVTs too. Sometimes a DVT could mask the symptoms of a virus, so we definitely want to make sure that we're not missing that. Vital signs, blood pressure, okay. Heart rate, we're a little bit abnormal. Okay, I'm gonna go ahead and measure your chest area. Looking for any distension and any inflammation, although I did not have a chance yet to palpate your abdomen, but I'll definitely get to that. Okay, and your arms, good. Okay, let's go ahead and measure your head too. Your arms, circumference, good. Okay, so I'm gonna go ahead and write all of this down before I forget. Go ahead and measure your hips from one pubic bone to the other. Okay? And your legs. Okay, looks good. Okay, good. I would also like to measure your inflammation markers on your face. Okay, so for that I'm going to ask you to look straight behind me at the wall. I'm going to try to measure your pupils. Okay, let's go ahead and check the other sides. Good. That looks asymmetric. Good, about that. Alright, so definitely one is more dilated than the other. I am not sure what that means yet because we do need to find a little bit more symptoms, okay, and signs. So we'll keep on looking. That's what it means. Don't be alarmed yet. Okay. I would also like to listen to your heart and your lungs. Okay, so go ahead and just breathe normal for me. I'm going to put my stethoscope here on your chest, and I'm just going to go ahead and lift the gown up a little bit. Okay. Very good. Pulmonic and aortic areas, they present a normal heart rhythm. I can hear only S1 and S2, no S3, no S4. I'm going to go ahead and ask you to take a deep breath in now. Alright, go ahead and take a deep breath in. And exhale. And again, take a deep breath in. And exhale. Very good. And I'll listen to your back as well, okay? Okay, go ahead and take a deep breath in. And exhale. And again, take a deep breath in. And exhale. Okay, very good. Looks like everything is excellent. And I'm going to go ahead and just palpate your abdomen. Is that okay? Okay. I'm going to put my hands under the blanket just to make sure that I'm getting a very good palpation of all abdominal organs. Alright, so go ahead and just relax. Breathe normal for me. Good. Okay. Good. Okay, epigastric area is not inflamed, no tender there. And just palpating the liver masses. I don't feel anything. Okay. And now we're down to the pelvic organs. Doesn't seem to be any inflammation here. It's non-tender. Okay, very good. Alright, let's go ahead and just listen. I want to make sure that we're not disturbing the abdominal area by doing that, but I think just by taking a quick listen, we're going to be able to find out if there is proper mobility. Okay, good. Good. Okay. I'm still not very convinced that there is no inflammation. I'm going to go ahead and percuss. Alright, so let's see here. Any pain? Any pain? Okay. All those are normal sounds. Okay. Alright, I think everything looks very normal. Alright, let's go ahead and fix your blanket here. I would like to check your reflexes as well. Go ahead and relax your wrist here. Okay. Your shoulders. Both areas. Okay. Okay. And I'll also tap on your chin. Let me know if you feel any pain. Okay. That's good. And your knees. Okay. Okay. Alright, I'm gonna go ahead and just sit here next to you. Is that okay? Okay. One thing that I would love to do is to check for any inflammation on your scalp. Alright. So I'm gonna go ahead and just take a look on the scalp area and see if there is any redness, any bumps, anything that would, try to trigger a concern for any inflammation. Okay, so go ahead and just relax. You can close your eyes. I'll come very close to you and I'll examine your scalp. Okay, there doesn't seem to be any inflammation on that side. Okay. I'm just gonna go ahead and type this down. No inflammation on the scalp area. So that's very reassuring. I'm gonna go ahead and just palpate your face, okay? Any pain here? Sinuses just seem to be a little bit inflamed. Okay. Any pain here? Okay. Okay. Any pain here? Any pain here as I'm palpating this? It doesn't seem to be any inflammation on your face, and the measurements were only for the pupils. I'm gonna go ahead and do a sharp or dull test. Have you ever had one done before? Okay, so what I'm gonna do is I will touch you with this kind of pointy and sharp object. Okay, it doesn't hurt at all. I'm gonna go ahead and show you what it feels like on your chest. Is that okay? So this is what it's gonna feel like. Okay, very good. So what we're gonna do is I'll touch you on different parts of your body, and I need you to tell me if you feel left or right, okay? Okay. Very good. Very good. Good. Okay. Excellent. Okay. Alright, keep your eyes closed, okay? I think I forgot to mention that, but this is not your first sensitivity test. Okay, left or right? Good. Okay. Okay. So what I'm going to do is I will also test your sensitivity, but under the blanket, okay? So I'm just going to gently lift it up, and you tell me if you feel left or right. Okay, good. Left or right? Okay, good. Left or right? Good. And now I'll check your facial sensation. I'm going to touch you with a soft texture, which is going to feel like this. And also a sharp texture, which is going to feel like this. Okay. Go ahead and close your eyes. Good. And tell me if you feel sharp or dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. All right. Looks very good. I'm gonna go ahead and do a taste and a smell test. So first I'm going to check your smell. And I'm going to ask you to keep your eyes closed. Okay, good. And cover one nostril. Good. And now breathe in, breathe out through your nose. And again, go ahead and switch and do the same thing. Breathe in, breathe out through your nose. Okay, very good. Now let's go ahead and try that one more time. And keep that nostril covered. And can you please take a deep breath in through your nose? Good. And breathe out through your mouth. Can you tell me what that smells like? Very good. Alright, I'm going to go ahead and try one more. Now, can you please cover your other nostril? Good. Can you take a deep breath in through your nose and out through your mouth? Okay. What does that smell like? Coconut. Okay. Very good. Let's go ahead and check your mouth. Just looking for my light here. Okay, can you please open wide? Very good. Okay. So I would say the glands are a little bit inflamed. And there is some redness in the back of your throat. I am not surprised at all to see that because I was really waiting for, for some flu-like symptoms to come up. All right, so what we're gonna do is I will give you a little bit of medicine. This medicine you can take every hour, about 5 little balls. You can chew or swallow, whatever is easier for you. And they do have a very high dose of zinc, which really helps when you are under the weather like this, and also vitamin C. All right. So what I'm going to do is first, what I'm going to ask you to do is to open your mouth, and I will directly pour the balls under your tongue to dissolve. Okay. So go ahead and open your mouth. More. Good. That sounds about right. Now I will put this medicine right here at the bedside next to you, and I'll ask you to don't forget to take about 5 of those little balls and put them under your tongue to dissolve better every hour. Alright, so right now it's about 9 p.m. In 1 hour, I need you to wake up and do this again. Alright. One more thing. I'm going to go ahead and give you a little bit of vitamin D. Also helps with immunity. Go ahead and give me a big ah. Good. Gonna go ahead and place this, and I'll have the nurse to give you another dose tomorrow morning. So what I'm gonna do is I will also perform an ear exam just to make sure that there is no infection there. And are you having any nose problems? You seem like you're breathing through your mouth a lot. Okay, so sinuses. Okay, let's go ahead and open your nose a little bit better. So what I'm gonna do, I will first check inside of your nose, and just to make sure that there is no mucus or anything obstructing the canal. Can you please look up for me? Okay. Looks like on the right side there is a little bit of redness. Okay. Both sides there's definitely redness. So what I would like to do is to extract whatever is stuck inside there. Now there is something stuck for sure. So what I'm gonna do is I will try to suction it. All right, go ahead and relax for me. Some spray. It's going to help to relieve inflammation. So we're going to put 2 sprays in each nair. Okay. Go ahead and breathe that in. Good. And one more time. Breathe in. Okay. Very good. I'm going to go ahead and check your taste. So I'll put 1 drop on your tongue. Can you please open? And can you tell me what that tastes like? Chocolate. Good. Let's go ahead and try that again. Please open. Can you please tell me what that tastes like? Peppermint. Alright. Very good. No concerns there. Okay, and I would also like to check your eyes. Can you please look straight at my nose now? Okay, keep on looking straight at my nose. Can you please follow the light with your eyes only? Don't move your head. Again. Okay, and again. Keep on following the light. Okay, now can you please focus right here behind me at the door? I'm going to go ahead and press gently down on your eyelid. On the other side. Very good. Alright, I'm going to go ahead and check your optic nerve. Can you please look behind me? Looking behind me at the wall. Good. Keep on looking behind me. Good. Optic nerve is intact. There's no signs of infection. Okay. Now go ahead and keep on looking at the door behind me. wrong. There's no infection in the eyes. Alright, let's go ahead and check your ears now. Can you please look that way? Just want to make sure there's no infection here. Good. Okay, the membrane is dark gray. I'm not seeing any redness. Alright, let's go ahead and check your other side. Looks like there is some sort of ear infection going on over here. A little bit of redness, a little bit of drainage. Not a lot though. Okay. Any pain when I'm doing this? Alright, keep your eyes closed. Go ahead and tell me with which ear you hear this sound. Good. Okay. I'm going to whisper some words in your ears. Can you please repeat them back? 1989. Good. June 1st, 88. Good. 1969. Okay. And 2054. Okay. So it looks like everything is in order there. Okay. I'm gonna go ahead and order your discharge papers. Everything looks good. I gave you a little bit of medicine, and I think by tomorrow morning you can go back home. Does that sound good? Alright, so I'm gonna go ahead and put the discharge order in. We're gonna take the IV out. And I'm going to send you home with some medications. One of them is going to be the homeopathic medicine that I just gave you, the little balls. And the other one is going to be vitamin D. Do you have any questions for me? Okay, wonderful. Well, I'm going to let you rest a little bit. And if you start to not feel too well, go ahead and press the call button. Okay? All right. Thank you so much for letting me take care of you tonight. I'll see you soon.